Good evening. Thanks so much for joining us. I'm Amy Burkett. Thousands of veterans live across our region, and more relocate here each and every day. That's why the U.S. Department of Veterans Affairs built a new healthcare center in Charlotte. Carolina Impact's Jeff Rivenbark went and checked it out for us.
Ray Haight enjoys playing computer war games.
Thor's Thunder.
He spends hours here in his man cave, as he calls it, surrounded by lots of patriotic and war memorabilia.
This is a Bronze Star with V and my Purple Heart, my Vietnam campaign medals, and then my good conduct.
Ask him about Vietnam, and he's got stories to share.
I was a combat platoon sergeant. My job was to lead a platoon to seek out the enemy and destroy them.
He also suffers from PTSD, or post-traumatic stress disorder.
This is what I do when I get under pressure, because in Vietnam, we have so much blood, we can't use our drinking water to get it off. You sweat and roll it off. And I can't stand the sticky. If I get anything sticky on my hand, which resembles that of blood, I have to get it off.
I look at myself more as a survivor than anything.
John Stegall served in Vietnam for 3 years in the late 60s.
After I'd been back a while, we noticed that my sugar level was going up, and so I developed diabetes. They tell me it had to do with Agent Orange.
3 times a week he goes to a kidney dialysis center. But for other health checkups, John drives to the VA outpatient clinic in University City or the VA hospital in Salisbury. But those drives could become less frequent with the opening of the VA's outpatient healthcare center in Southwest Charlotte.
The veteran population in not only Charlotte, but also North Carolina is continuing to grow.
Kid Mortimer says the new VA healthcare center is more than 4 times larger than the VA outpatient clinic in University City.
We needed a new facility in Charlotte in order to not only keep up with our current demand, but build and have the capacity for future demand that we expect to be coming into the next 10 and 20 years.
According to the U.S. Department of Veterans Affairs, more than 57,000 veterans live in Mecklenburg County, followed by 20,000 in York County, 16,000 in Gaston County, and 13,000 in Cabarrus and Union counties. But there are more than 182,000 veterans living across PBS Charlotte's 13-county coverage area. From CT scans to MRIs, the new center will offer a number of advanced medical procedures, which in the past veterans had to make a trip to the VA hospital in Salisbury or Columbia. Through these doors, we get to see inside one of the 4 operating rooms where same-day surgeries will be performed using state-of-the-art medical equipment. The center offers a number of specialty services such as cardiology, neurology, and oncology, as well as dialysis units and eventually a dental clinic.
Traditionally in the VA, the doctor had to put in a consultation, then it was looked at later, and then there was phone tag between the VA and the veteran trying to get an appointment set up. So we're trying to make things much easier for veterans and much more seamless for them.
In this area, 18 patient-aligned care teams consisting of physicians, nurses, and support staff will manage the health care needs of thousands of veterans.
So we're prepared every time we get a new surge in veterans to care for them and open up a new team. We have plenty of space in this building.
Everything in it is brand new.
As Director of Mecklenburg County Veteran Services, Jim Prosser hears lots of complaints about the VA from disgruntled veterans.
The wait times they've had and the travel to Salisbury for specialty appointments and those type of things. And now they're going to have it right here in our backyard, and that's what's exciting.
It's important for veterans to know this is not a hospital and doesn't have an emergency room.
Those are the 2 biggest things that we've been trying to make sure that everybody understands. It's gorgeous. It looks like a hospital. It's 6 floors, but it is still a super clinic.
VA officials tell us their goal is to offer the highest quality care and to be more efficient.
They've paid for this benefit with blood, sweat, and tears, and some of them even paid for it with their lives. So we have to make sure that we're providing the best service we possibly can to our veterans, and this state-of-the-art facility is part of that goal.
Ray Haight says that's a goal he hopes the VA and the new center can live up to, but for now, he's cautiously optimistic.
Sure, we're hopeful, but the main thing is keeping the facility full of the right doctors to where they can handle the load.
Back at the Stegall's home in Mint Hill, you can smell the collard greens and the potatoes cooking. Dinner's almost done. John steals a kiss from his wife, Jean. He's glad the new VA healthcare center is just a 30-minute drive away.
We're looking forward to the time that we can maybe eliminate some of those trips out of town for the typical services that we've been getting.
And before leaving, he reminds us of one thing.
I'm glad that I was able to serve my country.
And hopes his country makes it a priority to continue serving veterans and their healthcare needs. For Carolina Impact, I'm Jeff Rivenbark reporting.
Thanks so much, Jeff. Mecklenburg County officials funded a program that provides veterans transportation by taxi or CATS bus system to the new VA center. Union County also plans to start a transportation program to the clinic. For more information about the Charlotte VA Healthcare Center, we've got a link along with this story on the Carolina Impact page at pbscharlotte.org.